Hi, I'm Dr. Safala from Shrofi Hospital, Mumbai, India, and today I'm going to talk to you about the common questions that patients ask us when they seek laser vision correction to get rid of their spectacles or contact lenses. 100% of the patients who have heard of this new procedure called RELEX or SMILE want to know what is it. And RELEX is an acronym which stands for, the RE stands for refractive, L stands for lenticule, EX stands for extraction. So all it means is refractive, to do with your spectacle numbers, a lenticule, which is a part of the eye that we create to remove the spectacle powers, extraction, you extract the parts. So what is SMILE? So RELEX becomes the parent technology. SMILE is the exact method in removing it, which is small incision lenticular extraction. So in other words, what LASIK does, SMILE procedure does more gentler with using a different laser altogether. 70% of our patients want to know, since it's a new technology, how much experience is available with SMILE. So in the world today, SMILE has been around for a really long time, about 5 to 7 years. With Shrofi, we've been doing SMILE for the last year and a half, close to 2 years. And our results are excellent. 90% of the patients do ask us this question, that why have I not heard of the word SMILE? I hear a lot about LASIK, but no one's talked to me about this word called SMILE. So yes, you may not hear much about it because this technology has not yet hit US markets, and as you know, Google and all our internet space is crowded with US websites. So until it hits the US, there may be a little lack of marketing in terms of hearing more about SMILE procedures. It's very popular in European countries, London, even in Asian, South Asian countries, and it's also popular and getting more popular in India. The reason why SMILE is an expensive technology, many doctors may not invest in it. Those centers which cannot offer SMILE to you will not talk about it. So yes, 90% of you patients may not have heard of this technology called SMILE. So once they hear about the word SMILE, all the patients want to know, so what are the advantages of SMILE, RELEX SMILE over LASIK? The single most important advantage of SMILE is that it makes a safe procedure like LASIK far more safer. It makes it flapless, bladeless, and it does the same thing what LASIK would do, that is treat your entire power, but in a more gentle and a more safer manner. So the advantages to you would be a smaller incision compared to what you would get with LASIK, 80% less side cut, quicker recovery. People with who have undergone LASIK can go back to swimming and activities like scuba diving, sporting activities, not before a month or at least 3 months, whereas with SMILE they can even go back in the next 2-3 days even. So SMILE is a more recent technology, yes, but it is there to make things more quicker, recovery faster, and much more safer for our patients. We have come across this, that 90% of the patients, once they hear about SMILE and once they know about this technology, they do prefer it. They prefer it over LASIK. So why? Everyone wants something safe for their eyes, and the safer route to achieve the same result is going to take that. The only fear people have today regarding LASIK or any laser procedure is the fear of complications. And SMILE has been born only to deal with that. It takes away all the complications that LASIK would have brought on your plate. So yes, once they hear about the advantages of SMILE, not just the patient, but over 90% of the doctors use it in their practice. If they have SMILE, they prefer it for 90% of their myopic patients. So is SMILE accurate? Is it safe? Yes, all want to know, is it accurate or safe? Even the doctors want to know about that. And yes, it is. It is extremely accurate. It's from the Carl Zeiss technology, and Carl Zeiss as a company in optics has been around for decades. And the whole idea of the birth of SMILE was to make it more safer for you. Now, obviously, once you know about all this, the most obvious question would be, so am I a suitable candidate for SMILE? So to know about the suitability, at our center at Shroff Eye Hospital in Mumbai, Dr. Anand Shroff does a series of tests to see whether you are a fit candidate for any laser procedure. During this examination, he's not just looking at your quantitative analysis to see if you're going to become PAR 0, but he's also going to see that you do not get any side effects of any laser procedure like dry eyes or night vision issues, problems on cornea, corneal ectasia, and these factors determine your eligibility. So it's only when you step in and do a proper checkup with the doctor who's a corneal surgeon who does LASIK or does SMILE or both, that's when you come to know that you're suitable for it. But by and large, yes, you have to be under the age of 40, preferably, though we do patients who are over 40, but then the lifestyle has to be talked about. They have to be more outgoing, on the road, frequent travelers, and more important, after 40, willing to accept reading glasses. There is no holy grail in treating reading numbers, so anyone over 40 is going to require reading glasses. So yes, preferably those who are suitable for any laser procedure, including SMILE, have to be between the age of 18 and 40, should have powers preferably around less than -10. And yes, those who have plus numbers or hyperopes, unfortunately, SMILE has not extended its spectrum to treating the plus or hyperopes. So with this, at least a generalized idea to know what is SMILE about and how you can go ahead. But the next best step for you would be to meet Dr. Anand Shroff, our laser surgeon, and find out from him through a series of tests whether you are a suitable candidate for the SMILE procedure. We look forward to seeing you at Shroff Eye Hospital, Mumbai, in Bandra West and Marine Drive. And if you have any query, please write to us. Our email ID is info@shroffeye.org. And you can visit our websites. For Relax Smile, it is www.smilerelax.com. I'm Dr. Safila, and you can also call me on my number 9821163901. I look forward to hearing from you, and I'm happy to answer any queries that you may have on this procedure. Thank you and a good day to you.